What drew me to general internal medicine is just the breadth of clinical exposures you get. So on a given day, you can be in clinic managing chronic disease, in the hospital managing acute, unstable patients, or reading stress tests. And that variability from day to day and hour to hour is really exciting.
I think that it's a great opportunity to really have a holistic view of your patient and get to know the whole patient. On subspecialties, you tend to focus on one system overall, but I always found it a bit hard to do that when I wanted to look at their other problems too.
We have a lot of flexibility, and the residents use that. They do a lot of very different things, which is kind of exciting. They're always coming up with new ideas for things to try and do, and as long as it's somewhat academically relevant and relevant to their future career path, I'm all for it.
Everyone knows each other, and they're really invested at making sure you, wherever you start from, develop into a really competent and expert, independent physician.
There's a lot of attention to teaching and mentorship and helping the residents progress. We have a lot of buy-in and engagement from the faculty, so it's a really nice program to help residents grow. I think that's a real strength.
It's small and collegial, and the staff are so approachable that I've felt comfortable enough just to knock on someone's door for patient advice or for career planning advice.
I do think there's a big benefit to training in a small center. The staff know you, so they can look at areas you're weak and make them stronger, but also look at areas that you're strong in and really help you to become an expert in that area. And that individualized attention, I can't imagine it working as well as it does here in a larger center.
We also have figured out CPME and implemented it long before the rest of the country, so that's a real strength these days. CPME really is just a way of structuring your assessments and your feedback to capture what we should already be doing in a good training program, which is paying attention to what the residents are doing and giving them good quality feedback, and then closing the loop to say, overall, how are things going? What can we work on?
What I love best about practicing internal medicine here is we see patients through the entire course of their illness. When they come in really sick, managing them and their chronic diseases in clinic follow-up as an outpatient, doing research studies on those individuals or the diseases, and also presenting at conferences. So we really see the entire trajectory of a patient's illness to wellness, which I find very fulfilling.
There's such a wide breadth of what you could choose as a career path that you could really make it anything that you want to. You could do more office, or you could do more inpatients, work with more critically ill patients, take on leadership roles, or do research. So really, if someone wants a career with a lot of variety, that's always challenging and where you're always seeing something different, I think general internal medicine would be a great choice.
I get to work in a beautiful city where my commute is 15 minutes and we get to sit out in the park in the sun. I think residency is busy, life as a doctor is busy, and it's important to be in a place where you have good quality of life alongside the quality of work.